Hi, my name is Crystal Patterson. I'm going to be doing the intramuscular injection today. With me, I have my patient, my gloves. This is my sharps container, hand sanitizer, some gauze, a few alcohol wipes. I have the morphine sulfate injection, which is 4 milligrams per milliliter. I have with me a 22 gauge 1-inch syringe. For this type of injection, we can do 22 to 25 inch gauge, or 22 to 25 gauge, 1 to 1.5 inch needle. The syringe I have with me is a 3 milliliter syringe. I'm gonna go ahead and verify our order in the EHR. The order does state that the doctor has ordered 6 milligrams, and since what we have on file is a 4 milligrams per ml, I'm gonna go ahead and do those calculations and end up being 1.5 milliliters for this injection for the patient. I'm gonna verify with the MAR that this is correct. Everything seems to be okay. I'm gonna verify I have the right patient, the right time, the right route, the right dose, the right medication, and the right documentation. I'm gonna go ahead and come in the patient's room, knock on the door. They say it's okay to come in. I'm gonna shut the door, shut the curtain for patient privacy, and go ahead and introduce myself to the patient. Hi, my name is Crystal. I'm going to be your nurse today. The doctor has ordered you to have an injection, so we're just gonna go over a few things, and then we're gonna go ahead and proceed. First, can I ask you your name and your date of birth, and can I verify it with your wristband? Okay, thank you so much. Everything is correct. Are you allergic to any medication? No? Okay. You're not allergic to, are you allergic to any kind of food or anything in the environment? No. Okay. The doctor's ordered you a pain medication. Are you in pain currently? You are. Okay, on a scale of 1 to 10, with 1 being the least amount of pain and 10 being the most amount of pain, what would you rate your pain at? At a 7? Okay, then we'll go ahead and we'll proceed with this medication. Just to let you know that morphine sulfate is the medication that the doctor has prescribed you. Morphine is a medication for pain. It masks the pain receptors and makes them seem like there isn't a lot of pain going into your body. It masks it so you can be a little bit more comfortable. Some of the common side effects are constipation and drowsiness. The adverse side effects can be trouble breathing or hives, which is an allergic reaction. Please let me know if any of those things happen, and we will we'll take care of it at that time. Do you have any questions? No? Okay. I'm going to verify with the MAR in the EHR that everything is correct. This is my second check, that we have the correct patient, the correct time, the correct route, the correct dose, the correct medication, and the correct documentation. It seems like everything is correct, so I'm going to go ahead and perform hand hygiene and go ahead and put on my gloves. Okay. Go ahead and wipe the vial to clean it off. Okay, throw that away. And go ahead and take out the syringe and attach the needle to it while that dries. We don't want to put our hand over it to fan it in any way or blow on it. We just want to let it dry on its own. I'm going to go ahead and take this off. Before I take it off, I'm going to put it down to 1.5 milliliters, which is what we're going to be giving to the patient. Go ahead and take the lid off, drop it. With my dominant hand, I'm going to go ahead and inject it into it, invert it, put the air into the vial, and go ahead and pull it out. We like to pull it out just a little bit past the 1.5 to make sure all the oxygen air bubbles go to the top. Just a little, and then push it back in. That way we don't have any air bubbles at all. Go back up to 1.5, and I think I see a bubble. Okay. Go ahead and take that out. Do the little one scoop method. Go ahead and scoop that back, the needle back in there. Go ahead, make it go in. Show are at 1.5 milliliters. And at this time, I'm gonna go ahead and throw away my trash. I'm gonna ask the patient to lie on their side and expose their hip area. I'm gonna go ahead and put my hand on the greater trochanter, put my thumb down towards the groin area. My finger, my pointer finger will be at the superior anterior iliac spine, and my middle finger will be at the iliac crest pointed towards it. And this B area right here is where we're going to go ahead and do the injection at. I'm gonna go ahead and put a piece of gauze there so we know where our injection is going to be. I'm gonna remove my hand and go ahead and inspect the area. Make sure there is no bruising, no swelling, no inflammation, no wounds, no redness, and then go ahead and palpate it to make sure there is no pain or tenderness at the site. And go ahead and open up the next alcohol swab. I'm gonna go ahead and check my third check to make sure I have the correct patient, the correct time, correct dose, correct route, and everything seems to be in order. So we're gonna go ahead and we're gonna do it one more. We're gonna go ahead and clean the area. Since this is where we're going to be doing it, I'm gonna go ahead and remove the gauze. I'm gonna go in a circle about 2 inches out, cleaning it. Go ahead and let that dry. Do you have any questions? No? Okay. All right. So I'm gonna go ahead, release that. Hold this with my dominant hand. Go ahead and pinch the skin. Exactly where we were gonna go. Go in, give the injection. Go ahead and we're gonna do 10 seconds per 1 ml. Okay. Let it, go ahead and take it out. Pinching while I'm doing it. Go ahead and relieve myself of the syringe. Let it go. Put the gauze on it to make sure that there is no bleeding. There isn't. Okay, if you have any questions or any adverse reactions, please let me know immediately. I'm gonna go ahead and remove my gloves, put on hand sanitizer. I'm gonna leave the patient in a place of comfort, give the patient their call light so they can call me and let me know. I'm gonna thank the patient for letting me give them the injection today. And I'm gonna go ahead and document my procedure with the 6 rights: the right patient, the right time, the right route, the right dose, the right drug, the medication, and the right documentation, and if there was any adverse side effects or reactions.